Spinal column is the center of the axial skeleton. It gives the rest of our body structure and stability and protects our spinal cord from injury. The spinal column is divided into three parts: cervical, thoracic, and lumbar. The intervertebral disc is made of fibrocartilage, which absorbs shock that could otherwise damage our vertebrae. The body is the weight-bearing portion of the vertebrae. The pedicles attach the body to the rest of the vertebra. The transverse process proceeds or extends outwards from the vertebra and has different functions depending on which region of the spinal column the vertebra comes from.
The articular processes do just as their name implies. They articulate other vertebrae as we move our body in different directions. There are articular processes that articulate with both the vertebra above and the vertebra below. So there are 4 articular processes per vertebra. On each articular process, the smooth portions that slide on one another are called articular facets. The lamina is the connection between the transverse process and the spinous process, which is the most posterior portion of each vertebra. The vertebramen is a large opening in the middle of the body. Pedicles, transverse processes, lamina, and spinous processes. The spinal cord and the cerebrospinal fluid are inside the vertebral foramen, so the foramen is large to accommodate both.
It may help you to think of the structures that we've covered as land masses and bridges. There's a spinous process island and vertebral body island that are separated by the vertebral foramen ocean. On each side of the ocean and in between the spinous process island and body island are the transverse process islands. As the people living on the islands found it difficult to always travel by boat between the islands, they built bridges to connect everything. Pedicle bridges connect the body island to the transverse process island, and lamina bridges were built to connect the transverse process islands to the spinous process island. Near the lamina bridges are the articular process mountains.
The structures we have covered are common to cervical, thoracic, and lumbar vertebrae, but the overall shape, position, and function differ in all 3. We have 7 cervical vertebrae, cervical referring to the neck. These vertebrae protect the lower portion of the brainstem. One unique feature of these vertebrae is the existence of transverse foramen, a space where vertebral arteries, vertebral veins, and nerves pass through. They are protected by the bone surrounding them. 2 of the cervical vertebrae have special functions, the atlas and the axis. The atlas is the vertebra that immediately holds up our head, just like Atlas from mythology held the entire world. The axis sits below the atlas and allows for a high level of rotation around the dens or odontoid process. It is a rotational axis for our head. The dens is anterior on the axis. As you can see here, it is opposite the small spinous process.
We have 12 thoracic vertebrae, which, unlike cervical and thoracic vertebrae, articulate with our ribs. For this reason, there are additional facets on the thoracic vertebrae. Costal facets are on the anterior side of the transverse processes, and costal demifacets are on the body of the vertebrae. One rib will simultaneously articulate with a costal demifacet of 2 different vertebrae, but will only articulate with one costal facet. Beyond that, our thoracic vertebrae have rotational and flexion capabilities, allowing us a large range of motion in our upper limbs.
We have 5 lumbar vertebrae, which are the largest vertebrae we have. The vertebral bodies are especially large to bear more added weight from a larger portion of the body. Around the 3rd lumbar vertebra is the cauda equina. This is where the spinal cord branches into many large nerves. Lumbar vertebrae have mostly flexion and extension capability. This is because the articular facets face each other and have more limited range of motion as compared to thoracic vertebrae.
Problems with our vertebrae are serious. Scoliosis is a misalignment problem of the vertebrae that can be caused by deformities of the vertebrae and or fusion of the vertebrae. Scoliosis can be easily diagnosed by visualizing and palpating the spinal column in a physical examination. Herniated discs are caused by an extreme amount of pressure to the vertebral column, which causes a portion of the intervertebral disc to protrude into the vertebral foramen. This puts pressure on the spinal cord and nerves, which can cause pain and numbness that can radiate into the extremities. Because this is a condition of pressure on the intervertebral disc, pain would be more intense if the patient was standing or sitting upright.
Spina bifida oculata is a deformity of the vertebra in which the lamina, or spinous processes, never develop. This allows the spinal cord to protrude from the vertebral frame. It doesn't always cause problems, but when it does, some symptoms are back and leg pain, numbness in the back and legs, deformed legs, feet and back, leg weakness, and bladder or bowel function. Thank you for watching, and good luck on your quiz.